So I'm an exercise physiologist. I'm interested in the role of exercise in prevention and management of long-term conditions. I've worked with people with MS, cancer, cardiovascular disease. And so a lot of the people who I train with work with athletes, but I chose to work with clinical populations. I find it a lot more rewarding. So it's been known for many centuries, as far back as the 9th century BC, the Indian system of yoga, and also Hippocrates, 4th century BC. We've known about the health benefits of exercise for centuries, literally. I'm an exercise physiologist, so I got into this by being interested in the physiological adaptations to exercise. So on this side, you can see all the physiological benefits of physical activity. Since I started working with patient groups, I've really become accustomed to this side, all the side effects. So the good thing about exercise is the side effects are all positive. You get all these spin-offs, all these psychosocial benefits of engaging in physical activity. And that's something that I've really learned about as I've been working with people with MS and other clinical populations. We were very fortunate to get a trial funded by the MS Society, and we published the results last year. And this involved 120 people with MS. They had mild to moderate MS with an EDSS score of up to 6.5. So all were ambulatory, some with a stick, but most were more mildly affected. So this was a randomized controlled trial. And the aim really was to see if we could design something that was pragmatic, that people with MS could engage with. So it was a randomized trial, so 120 people with MS. We had a control group. In this situation, in our study, the out-of-control group, they were the ones who got the exercise. So what they got was, they got 2 supervised sessions a week for the first 6 weeks, and we prescribed a home exercise session. So that was 3 exercise sessions in the first 6 weeks. In the second 6-week block, we tapered it down. So we offered 1 supervised exercise session and prescribed 2 home exercise sessions. The idea was to try and pass the book to the participants to get them to take more responsibility for their physical activity behavior in the hope that would enable them to maintain a physically active lifestyle after the 12-week supervised period. In a nutshell, the backbone of the exercise program was aerobic exercise. It was individualized so that the participants could choose what they wanted to do, but it was small. We used small bites of aerobic exercise, so only 5-minute bites of different types of aerobic exercise. So people wouldn't get too hot. They would do 5 minutes, then go on to have a little rest, then go on to the next, and move around the lab, move around the exercise lab. They also did some resistance exercise, and this is quite easy to do. You can use weights, you can use elastic bands, and you can use body resistance. So we did a little bit of resistance exercise, and we also did some balance training. It was very collaborative. We had exercise scientists working alongside physiotherapists as well. So, and we had a neurologist as well working on the team. We also included what we call cognitive behavioral techniques because we know that exercise works, but one of the major challenges is how do we get people to change their behavior and adhere to that new changed behavior? So we used, using the trans-theoretical model, which is as the basis for this, we wanted to educate people about the benefits of exercise, but also find out what they could do easily in their home environments, whether they had social support structures. So these are all important factors in why people maintain a physically active lifestyle. So we did this outside of the supervised sessions. We measured a lot of outcomes. The primary outcome was free living physical activity behavior. So we wanted to see if the intervention had an impact on physical activity behavior, whether it made people with MS more physically active. But we also measured a lot of other things, such as functional, quality of life, and we measured fatigue. So a lot of important health outcomes were measured in this trial. As you can see here, on this side, this is the adherence to supervised sessions, and here we have the adherence to home exercise sessions. And you can see the adherence was very high, very good. So people with MS really engaged with the program, they adhered to it, and it was good compliance. The main message here, that we looked at how much exercise they were doing, and on average, it was about, this is 789 minutes in total, about 65 minutes a week. So that's only an hour a week. So they were doing, on average, 1 hour of exercise a week, which is less than half of the government physical activity recommendations. What were people doing at home? Well, if we look at this by EDSS score, walking was the predominant physical activity at home. The at-home exercise was mainly walking, but people did join leisure centres in these groups, less so in this group here. So this slide just shows that we did see an improvement in physical activity behaviour at 12 weeks. We then said, keep this going, and we'll see you again in another 6 months. And we measured it again, and the objective evidence seemed to suggest that they'd gone back to where they were, but the subjective evidence suggested that they were still doing more than they were at baseline. So we're not sure what this story is there, but we're probably more inclined to believe the objective evidence. We can see here the effects on quality of life. This is at 3 months or 12 weeks. The yellow dots are all positive improvements, and these are all quality of life domains. At 9 months, so between 12 weeks and 9 months, we didn't give them any supervised exercise. You can see there's still some quality of life benefits, but most had regressed back. We know that fatigue is a big problem for people with MS. And what we saw here, this is the proportion of people in the exercise group who were experiencing clinically important levels of fatigue before the exercise. And this is before the exercise, this is after. So the number of people experiencing clinically important levels of fatigue was reduced by the exercise program at 12 weeks. There was still evidence that there was reduced fatigue at 9 months, but it wasn't significant. So it has started to regress back. This is what you might most be interested in, some quotes just to finish off on. So what did people think about it? There were lots of positive benefits in terms of, so they loved coming, they enjoyed coming to the sessions. In relation to fatigue, a positive outlook, and physical benefits. We had lots of quotes in those 3 domains. Had an impact on family relations, confidence, and also social impact, so enabling people to socialise better. I'll just leave you with one thought, which is this quote by Plato. Thank you very much. Well, we measured it. At 9 months, we measured free living physical activity using an accelerometer, which is the objective way. They did a little box on their hip for 7 days, and we record all the movement data. We also asked them using a questionnaire. The objective data suggests that it was back to baseline. The subjective data suggested they were doing more than at baseline. But can you believe the subjective data? That's the question.
It's always tricky.
Yes. Everything that you've said echoes what we discover in our multiple sclerosis therapy centres. There are 50 of them in the country. All the things that you've described are things which our patients, the members of our centres, do every time they come into the centre in a gym. And far from stopping after 9 months, they go on, some of them for the rest of their lives. There are some who've been going for 20 years with considerable benefits from the physio gym. And I wish that more people who have MS would join them, because that is exactly what they need.
Yeah, I totally accept that. And also, because it was a research trial, we couldn't afford to allow people to keep coming. We had to recruit a certain amount of people. But if there's a centre where people can go, and get that continued support, that is very, very important. Yeah, that's fantastic news.
And I think it's also really important to emphasize being able to demonstrate objective evidence as well, so that we can then encourage funding for such as such. Yep.
But people with more mild MS found it easier to use leisure centres and go swimming. as the level of EDSS went up, it tended to be more activities of daily living and getting their physical activity that way rather than structured exercise at the gym or in the pool, or trying to walk when they could.
Right, thank you very much.
Okay.
There's a lot less research done in people who are wheelchair bound, and we need more research in that area. Having said that, I've done quite a lot of work with peripheral arterial disease, where people have trouble walking more than a few yards before they have to stop. And we found lots of health benefits from arm cranking exercise. So general cardiovascular systemic exercise benefits, and then that brings quality of life benefits as well. Strengthens the arms, also the heart. So, if you've seen these arm crankers, it's quite a good form of exercise.
Okay,
Yeah.
thank you.
Yeah, no, I recommend it because I think I would see core exercise, core stability as a form of kind of resistance training. You're doing isometric contractions, which is a static contraction, but I guess you could say it's a form of resistance exercise. So I would say exercises that strengthen the core, yes, very good, and very good for preventing back problems as well.
There's no physiotherapist that doesn't say that exercising the core isn't good, in my experience. Another question.
Exercise does have an anti-inflammatory effect or an antioxidant effect. There's evidence out there, certainly. Also, there are factors that are released from the brain which are stimulated by aerobic exercise as well. I'm doing a PhD project now, which is looking at the role of progressive resistance exercise in neuroplastic adaptation. So we're doing some TMS measures with resistance exercise as well. So hopefully that will yield some interesting information in a couple of years' time. Great point. Great point. We need more group activities, group classes for people with MS, because I had an interesting conversation here, I think, and they said, the social support, and I've seen it with people with MS and other clinical groups, coming together as a group, if you can do it, encourages motivation, encourages adherence. So we do need more of that. How do we get it? Probably training exercise practitioners up in the requirements for people with MS, but funding, it's a tricky one, but yes, I agree. The answer is yes. Even elite athletes have days, elite endurance athletes will have days when they go for long, steady runs and they don't let their heart rate go above a certain range because they're frightened of overtraining. And in some of our participants were so keen and enthusiastic, we had to rein them in and say, no, you need to titrate it on a personal level, work out what you can do, make sure it's progressive, because you can overdo it, and then you can be wiped out the next day. So it's important to do it in a progressive way.